Morning, everyone. So today we are going to discuss another topic, occupational hazards in dentistry. So let me share the PowerPoint presentation. Okay, as we dentists, we may come across a lot of hazards or accidents across our dental practice. So this chapter or this topic tells you the precautionary steps what you can take in order to avoid such hazards. So moving on to the important topics in my flow of presentation. First is introduction, ergonomics, allergy to latex gloves, effects of sound on dentist, air pollution and its control in dental office, effects of radiation, eye and facial injuries, mercury hygiene, transmission of infections, conclusion and references. So introducing the topic to you, what do you mean by ergonomics? Have you heard of the term ergonomics? So the dentist, we are all dentists, and the most important physiological physical hazards what we will come across, or after a few years of practice, we will experience some musculoskeletal discomfort, which is the most common or prevalent occupational hazards for the dentist. Each occupation has certain hazards, and this topic or this chapter we will see in detail about the occupational hazards that is broadly classified into physical, biological, chemical, and psychological hazards. So let me see what is this ergonomics. The definition says the study of all factors that relate to the quantity and quality of dental care delivered in comparison to the amount of work input and the amount of physical and the mental fatigue generated in the process. So the objective is a means by which an equal or greater work output can be achieved with less mental or physical fatigue experienced by the dentist. So these are the causes of various stresses in dental practice. Models of occupational stress acknowledge three major stress groups: job-related factors, external factors, and personal factors. According to Cooper et al., the major stresses in dental practice are time and scheduling problems, care-related stresses, patients' unfavorable perception towards dentists, staff and technical problems, problems dealing with the patients. Other variables are poor working conditions, routine, boring nature of the job. So these are the psychological stresses that we may come across in your future years of practice. So it can be job related, external factors, and due to some personal issues. You may experience various kind of stresses with relation to time and scheduling problems, the salary related stresses, and the uncooperative or unfavorable nature of your patient, and various stress experience from your fellow dentist or your assistant or your different kind of staffs. Then problems in handling your patients. Some of the physical stresses. Let me see some of the physical stresses. Some of the sources of physical stresses are long operative procedures, overbooking of the patients, improper positioning during treatment procedures. So the first and the foremost thing, we have to give much importance to the ergonomic side of your practice. That means the physical aspects, how you practice. So some books suggest that continuous standing or continuous sitting postures may cause so many or various kind of musculoskeletal discomfort to the dentist when we grow older. So long operative procedures, for example, continuous sitting posture or over scheduling of the patients. The number of patients what you see in a day is also a matter of concern, and also the improper positioning. Sometimes most of us doesn't know the various positions that we can make use of while treating a patient. So this kind of physical stresses we can manage with the medications, hypnotherapy, and physiotherapy. Then how to prevent these physical stresses? So we can indulge in various fitness programs, regular muscular exercise, walking or running at least 30 minutes or 1 hour a day, and various other physical exercises. As we all very much adapted to the sedentary lifestyle, we all are prone to various lifestyle diseases. So in order to avoid all these physical stresses, I strongly recommend to involve in various physical exercises. Then about the lifestyle factors, assuming good posture, cessation of smoking and drinking alcohol, weight control. We can see many of the dentists or many of us are obese and with heavy or huge tummies. And we are all due to the heavy stress in our 8 to 8 daily clinical practice. A few people may be involved in some smoking and other alcohol practices. So how to get rid of all such harmful habits. Then also we have to think about some changes to be made in the working environment. Chair should support your back and that put your knees slightly above your waist. Rest your arms on the arms of the chair to relax the muscles of the upper back. Replace manual tools with powered ones. Wear flat footwear. Use mouth mirror to avoid odd postures. We may see some people over bending while doing some treatment procedures in the upper tooth. You also, when in your student life, while doing some preclinical work in your second year, and also when you freshly start with your clinical practice in your clinical session in third year, you may adopt some wrong sitting postures. You may try to do a treatment in the upper arch by over bending, and these all may result in muscle spasms, and you have to avoid all such things. You should be well aware of the four-handed dentistry and the advisable chair position for each quadrant in the mouth. Then about the psychological or mental stresses, it may we may experience various mental stresses in the office, also outside your dental office. Some of the sources of mental stresses in the offices, in your dental office are listed out here. Falling behind schedule, striving for perfection, causing pain in patients, anxiety in patients, uncooperative patients, feeling responsible for patients' oral health, patients not complying with advice, having too few patients, not making enough money, patients not accepting the preferred treatment, too much of same kind of work, competition from other dentists, isolation. So in your busy work schedule, you may experience all this kind of mental stresses. You may compare yourself with the fellow dentist who is practicing nearby. You may think that you are getting only less number of patients. You may think about giving appointment for too many of patients. All these things causes you mental stresses inside your dental office. Some of the mental stresses that are arising outside your dental office include family-related, community problems, national and international events. So this is any of a person not necessarily be a dentist, can experience various kind of stresses due to the family issues, various society related issues, and also because of the various national and international events. So these kind of mental stresses are very common to us as we are all social animals. So how to manage this stress, both inside your dental office and outside the office? Be aware of the problems early. Use stress positively to propel yourself to act. Discipline yourself to take a break for a lunch. Inject loafer daily. Deliberately chat with the patients before and after treatment. Manage time deliberately. Space patient support. Allow for a day off. Plan a special mom and dad time. Use acceptable outlets for anger at home. So you are a dentist. You are equally a responsible father, mother, son, daughter, and everything else. So you have to be very patient to your children, very patient to your parents, and you should find time to be spend some time with your friends, family, and you should love, you should smile, and you should develop a positive mental attitude in order to get rid of all these stresses. Use the family as an emotional buffer zone. Home is the best place to relax and recreate. Develop and nurture good friendship networks with give and take of ideas, mental good physical health. So all these states that you have to get rid of, you have to leave your mental pressure inside your dental office itself. You have to active involved with your families, with your friends, and find some time to spend very actively with these people. Treating yourself to 20 minutes of relaxation during the day can help promote health, prevent illness, and prepare for clear thinking and decision making. And yoga, meditation, and a morning exercise makes you very much relaxed from all these kind of stresses. Also, in order to avoid the physical stresses, I personally suggest you about the forehand dentistry. It is the art of seating both the dentist and the dental assistant in such a way that both are within easy reach of patient's mouth. The assistant will hand the dentist the particular instrument the dentist needs, and also she will perform additional tasks such as retraction and aspiration. So this states the importance of various dental auxiliaries. You make use of the your dental assistants properly. You must train them how to assist you in various treatment procedures. For example, while performing an RCT, while performing an extraction, so they should know when you are leaving your hand. They should know what this doctor wants, and if you can practice by making use of four-handed dentistry, it's very much or it's advisable for getting rid of all these physical or musculoskeletal problems. This shows you the positioning, how to position yourself and the patient and also your assistant while doing an upper arch treatment and also your lower arch treatment. So another aspect of the physical hazards. Some may be allergic to latex gloves. Latex exposure can occur through various routes: mucous membrane, through skin, respiratory system, and vascular system. Three type of reactions seen: irritant contact dermatitis, allergic contact dermatitis, typo and hypersensitivity reactions. According to the National Institute of Occupational Health and Safety, that is OSHA guidelines, use low protein powder free latex gloves. If you found allergic to the latex gloves, frequently clean all work areas contaminated with gloves. Educating the dental staff, use non-latex gloves, and also think about the hand hygiene. Effects of sound on dentist. This also comes under the physical hazard. Makes of all sound producing devices, air drive, high speed hand piece. Intensity of noise of the drill is influenced by its age and condition. Maximum ability of human to hear is 2000 hertz. 20,000 hertz. So guidelines for hearing protection, personal evaluation, noise attenuation, and personal protection. Also about the air pollution and its control in dental office. Transmission of infectious, toxic, and carcinogenic agents can occur by direct contact, indirect, or airborne route. Dentists inhaling these materials are stressed by them, and this adds to the total stress experienced by the dentist. So air pollution or contaminated or infection through biological methods, biological hazards is also a matter of concern for the dentist. List of non-hazardous materials in dentistry. So these are some of the materials which are very much hazardous to you in your clinical practice. Carcinogens, chloroform, epinephrine, and nitrates. Teratogenic events, nitrous oxide halotene. Contact dermatitis, mercury, iodine, benzoyl peroxide. Lung diseases, mercurial tubercle bacilli. Neurotoxicity, mercury. Wound infection, pyogenic microorganisms. Eye infection, streptococci and staphylococci. Also about the effects of radiation. Effects of radiation divided into carcinogenic effects, embryological effects, teratogenic effects, genetic effects. Radiation reduce recommendations. Make sure the instrument is safe and collimated. Limit the number of exposures. Always use lead apron. Use long cone barreling technique. Participate in the continuing education programs. So this is an important matter of concern for especially the lady dentists. So they must take all these precautionary things while handling with the radiation procedures. At least they may, few may be not using even the lead apron, and this may lead to future many complications. Next is eye and facial injuries. Accidental injuries resulting mainly from ultra-speed instrumentation, manipulation of instruments, and styling. Eye protection can be done by wearing safety spectacles. Mercury hygiene. Hazardous since at room temperature it remains liquid and seeps into crevices and mixes easily with the dust. Signs and symptoms of toxicity. Pharyngitis, dysphagia, abdominal pain, nausea and vomiting, swelling of salivary glands, stomatitis, nephritis, profuse salivation, tongue tremors, and metallic taste. So mercury toxicity is something like an important occupational hazard for the dentist. So we have to take care while handling with the amalgam fillings. So about the control measures, administrative control, environmental process control, and work practices. Risk of transmission of infections comes under the biological hazards. Infections like hepatitis, herpetic white low, HIV, and tuberculosis. And nowadays, we have to include the COVID-19 or coronavirus under this category, mainly through blood contact and saliva. Universal precautions should be followed. And in this COVID-19 pandemic, this is the reason why most of the clinics were asked to shut down, and only emergency procedures, that is especially the pain management, were only allowed by the government of India for the dentists across the country. Components of universal work precautions: protective barrier technique, use and care of sharp instruments, sterilization and or disinfection of instruments, use and care of handpieces, single-use disposable instruments, and disposal of waste. Protective barrier techniques like gloves should always be worn. That the 3M N95 mask or gloves are advisable. Always wash your hands and re-glove between patients. So hand hygiene is very important. Proper use of sanitizers and the proper use of quality mask and gloves is also advisable. Protective clothing such as reusable or disposable gowns should be worn. Spectacles should be used. Appropriate use of rubber dams, high vacuum suction, and proper positioning to minimize splattering or droplets and aerosols during treatment. Use and care of sharp instruments and needles. Sharp needles are potentially infectious, stored in puncture and resistant bottles. Needles should be destroyed by needle burner. So in the clinics, where especially in Kerala, we have this IMA goes eco-friendly image waste management system for most of the dental clinics. So we'll be asked to sort out these sharp instruments, needles, gloves, mask, and various others instruments or equipments what we are using in our practice, and we have to segregate it, and we have to keep it in the various color-coded bags before handling it to the disposal staff employed by the image. Sterilization and disinfection of instruments should be cleaned before to remove debris. Sterilized by hot sterilization for heat-sensitive instruments, sodium hypochlorite, povidone iodine, formalin, and glutaraldehyde. Use and care of hand pieces is also important. Dry heat or chemical vapor is recommended for all hand pieces. Single-use disposable instruments like cups and brushes, tips or high-volume evacuators, saliva ejectors, and air-water syringes. Disposable of waste as per rules of the municipal corporation. So, as I already mentioned, we have a proper disposal system employed by the Indian Medical Association by the name IMAGE. IMA goes eco-friendly. So concluding my topic, in a dental setting, the dentist and the dental staff may be infected by a variety of conditions, including hepatitis, HIV, AIDS. These conditions may be passed on to the patient or be spread in the clinical area between clinicians. Infection control in general dental procedures should be followed by using personal protective equipment, surface barriers, and disposable instruments to control cross infections and occupational exposures. A pragmatic policy on infection control and occupational safety should be mandatory during training period. So these are the references and these textbooks I strongly suggest for further reading. Thank you. Thank you for your patient listening.